Suicide. Folic acid tied to a reduction in suicide attempts. Suicide is a leading cause of death in the United States, having increased more than 30% from 2000 to 2018. Experts recommend many strategies and treatments to decrease the risk of suicide, including psychotherapy, peer support, economic support, and medications like antidepressants. Few if any would be likely to put folic acid supplements on that list, but a recent study done at the University of Chicago may change that. An inexpensive, safe, widely available treatment for preventing suicidal behavior could reverse this trend. A recent study investigated if taking folic acid was linked to a decrease in suicide attempts. Over 12 million adults thought about suicide, with 1.2 million actually attempting to end their lives, in 2020 according to data from the CDC. Researchers found people with a folic acid prescription experienced a 44% reduction in suicidal events. Prescription folic acid, a synthetic form of vitamin B9, may provide a safe and effective approach for decreasing suicidal ideation, new research suggests. After adjusting for multiple factors, results from a large pharmacoepidemiological study showed intake of folic acid was associated with a 44% reduction in suicide events. These results are really putting folic acid squarely on the map as a potential for large-scale, population-level prevention. This was told by lead author Robert D. Gibbons, Ph.D., Professor of Biostatistics, Center for Health Statistics, University of Chicago, Illinois. Folic acid is safe, inexpensive, and generally available. And if future randomized controlled trials show this association is beyond a shadow of a doubt causal, we have a new tool in the arsenal, Gibbons said. Having such a tool would be extremely important, given that suicide is such a significant public health crisis worldwide, he added. The findings were published online September 28 in JAMA Psychiatry. What is folic acid? Folic acid is a type of B vitamin. Many foods contain folate or will be enriched with folic acid. This nutrient is naturally high in foods such as vegetables. Especially dark green leafy vegetables such as spinach, mustard greens, and asparagus are rich in folic acid. Other foods which contain folate include nuts, beans, oranges and orange juice. These foods are naturally high in folate, while there are other foods that are fortified with folate, which means that while not naturally a good source, the vitamin is added during the manufacturing process. These foods include enriched breads, flours, pastas, rice, and cornmeal. Folic acid. It is important to make sure you consume enough folic acid, because it plays an important role in cell functioning and growth. Typically need about 400 micrograms of folate per day, while people who are pregnant should aim for 600 micrograms per day and those who are breastfeeding should aim for 500 micrograms per day. Previous research fairly thin. Folate, the naturally occurring form of B9, is essential for neurogenesis, nucleotide synthesis, and methylation of homocysteine. Past research has suggested that taking folate can prevent neural tube and heart defects in the fetus during pregnancy. Folic acid may prevent strokes and reduce age-related hearing loss in adults. In psychiatry, the role of folate has been recognized for more than a decade. It may enhance the effects of antidepressants. Folate deficiency can predict poorer response to selective serotonin reuptake inhibitors, SSRIs. This has led to recommendations for folate augmentation in patients with low or normal levels at the start of depression treatment. Although previous research has shown a link between folic acid and suicidality, the findings have been fairly thin, with studies being generally small, and many are case series, Gibbons said. Naomi Torres-Mackey, Ph.D., a clinical psychologist at Lenox Hill Hospital said, the impact of vitamin deficiency on mood has been previously studied, with B vitamins being the most commonly examined, particularly B12. There have also previously been studies on folate and depression, she said. Being mindful not to conflate depression and suicide, this study only looked at the latter, which is an important contribution to separate out and examine suicide in particular. Experts stress that more study is needed and that people in mental health crisis or who have thoughts of suicide should immediately seek medical help. Torres Mackey noted that it's important that people who have thoughts of suicide are seen by a mental health professional who has training in suicide and crisis management. The specific way in which suicidal ideation is treated depends on the underlying cause, as thoughts of suicide can be related to a mental health condition, commonly psychosis, or depression. This study seems to have promise, said Torres Mackey. The current study follows an earlier analysis that used a novel statistical methodology for generating drug safety signals that was developed by Gibbons and colleagues. Comparison. That study compared rates of suicide attempts before and after initiation of 922 drugs with at least 3,000 prescriptions. Its results showed 10 drugs were associated with increased risk after exposure, with the strongest associations for alprazolam, butalbital, hydrocodone, and combination codeine and promethazine. In addition, 44 drugs were associated with decreased risk, many of which were antidepressants and antipsychotics. One of the most interesting findings in terms of the decreased risk was for folic acid, said Gibbons. He and his colleagues initially thought this was because of women taking folic acid during pregnancy. But when restricting the analysis to men, they found the same effect. Their next step was to carry out the current large-scale pharmacoepidemiological study. Prescriptions for pain. Researchers used a health claims database that included 164 million enrollees. The study cohort was comprised of 866,586 adults with private health insurance, 81.3% women, 10.4% aged 60 years and older, who filled a folic acid prescription between 2012 and 2017. More than half of the folic acid prescriptions were associated with pain disorders. About 48% were for a single agent at a dosage of 1 mg/d, which is the upper tolerable limit for adults, including in pregnancy and lactation. Other single-agent daily dosages ranging from 0.4 mg to 5 mg accounted for 0.11% of prescriptions. The remainder were multivitamins. The participants were followed for 24 months. The within-person analysis compared suicide attempts or self-harm events resulting in an outpatient visit or inpatient admission during periods of folic acid treatment versus during periods without treatment. During the study period, the overall suicidal event rate was 133 per 100,000 population, which is 1/4 the national rate reported by the National Institutes of Health of 600 per 100,000. After adjusting for age, sex, diagnoses related to suicidal behavior and folic acid deficiency, history of folate-reducing medications, and history of suicidal events, the estimated hazard ratio, HR, for suicide events when taking folic acid was 0.56, 95% C, 0.48 to 0.65, which indicates a 44% reduction in suicide events. This is a very large decrease and is extremely significant and exciting, Gibbons said. He noted the decrease in suicidal events may have been even greater considering the study captured only prescription folic acid, and participants may also have taken over-the-counter products. The 44% reduction in suicide attempts may actually be an underestimate, said Gibbons. Age and sex did not moderate the association between folic acid and suicide attempts, and a similar association was found in women of childbearing age. Provocative results? The investigators also assessed a negative control group of 236,610 individuals using cyanocobalamin during the study period. Cyanocobalamin is a form of vitamin B12 that is essential for metabolism, blood cell synthesis, and the nervous system. It does not contain folic acid and is commonly used to treat anemia. Results showed no association between cyanocobalamin and suicidal events in the adjusted analysis. HR, 1.01, 95% C, 0.80 to 1.27, for unadjusted analysis, HR, 1.02, 95% C, 0.80 to 1.28. Gibbons noted this result boosts the argument that the association between folic acid and reduced suicidal attempts isn't just about health-seeking behavior like taking vitamin supplements. Another sensitivity analysis showed every additional month of treatment was associated with a 5% reduction in the suicidal event rate. This means the longer you take folic acid, the greater the benefit. Which is what you would expect to see if there was a real association between a treatment and an outcome, said Gibbons. The new results are so provocative that they really mandate the need for a well-controlled randomized controlled trial of folic acid and suicide events. Possibly in a high-risk population such as veterans, he noted. Such a study could use longitudinal assessments of suicidal events, such as the validated computerized adaptive test suicide scale, CAT-SS, he added. This continuous scale of suicidality ranges from subclinical, signifying helplessness, hopelessness, and loss of pleasure, to suicide attempts and completion. As for study limitations, the investigators note that this study was observational, so there could be selection effects. And using claims data likely underrepresented the number of suicidal events because of incomplete reporting. As the researchers point out, the rate of suicidal events in this study was much lower than the national rate. Other limitations cited were that the association between folic acid and suicidal events may be explained by healthy user bias. And although the investigators conducted a sensitivity analysis in women of childbearing age, they did not have data on women actively planning for a pregnancy. How folic acid might help. People who have thoughts of suicide are typically treated with a combination of medication and therapy. Lithium, ketamine, and antidepressants have been shown to reduce suicidal behavior. Neuroplasticity, our ability to adapt and think differently, is essential, especially when someone is in a crisis-like state such as suicidal ideation. Certain medications might improve neuroplasticity. In the case of folic acid, it plays a key role in the formation of various neurotransmitters. Serotonin, norepinephrine and even BDNF, brain-derived neurotrophic factor, which is like Miracle-Gro for certain brain areas, says Dimitriou. Impressive. He considered the study impressive. Given the low downside or side effect profile of using folic acid, I would certainly give it a go, Dimitriou said. Always seek professional help. Always seek professional help with anyone having suicidal thoughts, said Dimitriou. If it is truly urgent, safety first, call 911 or get the person to an emergency room to assure safety. He added that in his years of experience work, he cannot underscore how many people, who considered suicide, were so happy to be alive months later. Time heals, and you have to be safe to allow the healing to occur, Dimitriou pointed out. We live in a time of treatment options, use them. This large-scale pharmacoepidemiologic study of folic acid found a beneficial association in terms of lower rates of suicide attempts. The results warrant the conduct of a randomized clinical trial with suicidal ideation and behavior as outcomes of interest. If confirmed, folic acid may be a safe, inexpensive, and widely available treatment for suicidal ideation and behavior. Although Gibbons and his co-authors were careful to adjust for confounding factors, they cannot yet say for sure whether the relationship between folic acid and suicidal events is causal. That is, they don't yet know if taking folic acid will directly cause a person's risk of suicide to become lower. To know for sure, the authors are following up this study with a large-scale randomized controlled trial, RCT, to test whether folic acid directly lowers the risk of suicidal events, including ideation, attempts and completion. This will involve randomly splitting subjects into two groups, giving a placebo to one group and folic acid to the other and comparing the rate of suicidal events over time. If their findings are confirmed in the new research, folic acid would be a safe, inexpensive, and widely available suicide prevention strategy, and potentially help save thousands of lives.